to talk about one of the most common questions that I get from both my patients and from social media, and that is, what are the best sleeping positions for both the neck and for the lower back? So what are the best sleeping positions for the spine? Sleep, first of all, is one of the most overlooked aspects of our life. When we think about it, we spend a third of our life sleeping. If we're not doing that part correctly, it's going to affect the rest of our day, the rest of our life. Sleep is essentially when our body heals. And if we don't let it heal, you're going to have a shitty day. You're not going to feel that great. Your performances will suffer. So in terms of sleep, we want to think about not only quantity or the total amount of time that we're sleeping, but also quality. More specifically, what position are we putting our body into throughout the night? So let's first start off talking about what are the worst positions, what are bad positions for the neck and for the lower back with sleeping. First of all, stomach sleeping. Stomach sleeping is by far the worst position for both the neck and for the lower back. Got to get off the stomach. Do everything you can to avoid this, because it puts a tremendous amount of strain on both those areas. So with regards to the neck, essentially, if you're on your stomach, you got to choose one side versus the other. Think about if you were sitting at a desk at work all day, or on your computer for many hours in a row, and your computer was off to the side, and you're turned with your head and you're typing or you're doing your job, looking to the side all day long. I mean, it's gonna hurt, it's gonna get tight, especially if you try to go to the other side. It's going to run into all kinds of issues. And if you're on your stomach and you're sleeping, whatever position that is in, you're going to have to choose a side unless you're straight down, which I don't advise, because you probably will suffocate. With regards to the lower back, on your stomach, it puts that part of the spine in a hyperextended position. If you have hip flexor tightness, which is very common, if you have imbalances or issues in your pelvis or stiff thoracic spine, all very common things that we see, sleeping on your stomach is going to put a lot of strain on the joints in your lower back. There's really no way around it. You got to get off the stomach. Second worst position you want to try to avoid, and this is specifically to that lower back, is what I call the mountain climber position or Spider-Man position. So essentially what that is when you're lying on your side, or I should say side/stomach, and this top knee comes on over and hits the mattress. Oftentimes you're sleeping on your shoulder like this, and you're kind of in this very awkward position. It actually feels really good, but it's causing a lot of issues down in the lower back, in the hip, in the pelvis, this kind of whole lower quarter. It puts a lot of twisting torque on your back. It can cause tightness in that hip flexor. While this may feel comfortable, sleeping in this position all night long, if you haven't realized already, you'll wake up most of the time pretty sore and stiff, and over long periods of time, that position can cause issues in the back, in the lower back, and some of those other joints as well. So let's talk about what are good positions to sleep in. Let's go back to the neck. The main concept with the neck is you want it to be in a neutral position, so you can sleep both on your side or on your back, either side. Those are fine. What's important is the position that your head is in. For instance, if you're on your side, let's say I'm on my right side, you don't want that pillow or that height to be so thin that your head is side bent, or so thick that you're side bent the other way. You also don't want to be sleeping with your head in this kind of upwards extended position. You want the head neutral, meaning the chin close to the throat, something like this, as best you can while you sleep. So that could go either side or on your back. Just be careful if you're on your back. You don't want to sleep like this all night long. That'll also cause some issues. As far as the lower back is concerned, you can also sleep on either side, or you could sleep on your back. So let's talk about the side position first. If you're on your side, ideally you want to use a pillow between your knees. So when you do that, of course, I bought these pillowcases. I didn't even know these freaking giant pillowcases existed until I bought the wrong ones, but now I got these flappy pillowcases, but it is what it is. Anyways, pillow between the knees is ideal, okay? That's gonna keep the hips in a nice neutral position. It's gonna keep the back neutral. It's going to prevent any issues from developing from that twisting. Remember, you don't want that top knee to hit the mattress. Try to keep them back. Keep the legs stacked. Very important, okay? Either side is just fine for lying on your side. If you're one that decides to lie on your back, that's totally cool. What I would recommend, especially if you're dealing with lower back issues, you want to take a stack of pillows. I have 3 of them right here, and you want to put them underneath your knees when you sleep. So essentially, what you need to do is try to prevent hyperextension of that lower back when you're sleeping, and putting pillows under your knees will help to keep your back in a more neutral position. Now, take note, I have 3 pillows here. I'm a big dude, but I probably need 4. One pillow, 1 or 2, is not going to cut it. It needs to be significantly high enough to where you don't feel any arching in that lower back, and you want it to feel nice and neutral. So you just stick those big stack of pillows under the knees, relax the legs out, and this has actually been found to be one of the best positions to allow that lower back to heal and recover. So give those positions a try. If you're dealing with a lot of pain or issues, start here. This is a habit. It's not something I expect you to get in just one night or a couple nights. Could take a couple of weeks, could take a couple of months. If you wake up and the pillows are on the other side of the room, that's fine. Go grab them, bring them back over. The best thing you can do is try to spend a little bit of time in these positions each night till you start to get used to them, and it'll become easier as time goes on, and you'll notice that not only throughout your performances and your workouts, but throughout your day, you're going to feel a lot better. Give them a try, let me know what you think.